Welcome back, everyone, to another deep dive. This time, we're really going to get into the core concepts of health and wellness and illness and disease. The bedrock stuff for nursing practice, especially for those of you in fundamentals.
Absolutely.
We've got some pretty interesting perspectives and stories from the research. One that really stood out was about a college freshman who considers herself healthy despite some pretty intense exercise and a super restrictive diet, which really makes you think about how individual people view health.
Yeah, definitely. I think that's a great example of how health can be really subjective.
Yeah, for sure. And then there's another one about a young man with schizophrenia and how his case just shows how complex chronic illness can be. It really emphasizes the importance of long-term management and patient education.
Right. It's not just about treating the immediate problem, but helping people live with their conditions over time.
Exactly. And get this, we've even got a student's perspective who knew someone with a terminal illness but considered them healthy because of their amazing outlook on life.
Wow. That's really powerful. It makes you think about how much more there is to health than just the physical stuff.
Absolutely. But before we get too deep into those stories, let's start with the basics. What do we even mean when we talk about health and wellness?
Well, the World Health Organization, that's WHO, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity.
Okay, so it's not just about dodging the sniffles. It's way more than that.
Exactly. It's about being well in every aspect of your life.
Which brings us back to that college freshman. We only get a little snapshot of her story, but it seems like she's hyper-focused on the physical side of things, maybe at the expense of her mental and social well-being.
That's a really good point. As nurses, we have to remember that everyone's definition of health is different, and that influences how they approach their own health and healthcare.
So how does the idea of wellness fit into all of this?
Wellness is all about actively pursuing a healthy lifestyle. It's about making choices that support your overall well-being, mind, body, and spirit.
So it's like taking charge of your health instead of just waiting for something to go wrong.
Exactly. It's about thriving, not just surviving. And this leads us nicely to another important distinction, acute versus chronic illness.
Okay, yeah, those are two terms we hear all the time, but can you remind us what those mean exactly?
Sure, think of acute illness as something that comes on suddenly, like a cold or a flu. It's usually short-term and you recover fully. Chronic illness, on the other hand, is something that's ongoing and requires long-term management, like diabetes or heart disease.
So it's like the difference between a sprint and a marathon.
That's a great analogy. And with chronic illness, you often have periods where symptoms flare up, which we call exacerbations.
Right, and then there are times when the symptoms are less severe or even disappear for a while, which is called remission.
Exactly. So it's this ongoing cycle of managing symptoms and trying to maintain the best possible quality of life.
Like that young man, Daniel, with schizophrenia. Even though he had treatment before he was back at the clinic because his symptoms flared up again. So it's not a one-and-done situation.
Exactly. And unfortunately, chronic illnesses are becoming more and more common, which puts a big strain on our healthcare system.
Which brings us to another big topic, health disparities. We hear that term a lot. But what does it really mean in the context of healthcare?
Basically, it means that certain groups of people have much worse health outcomes than others, often due to social, economic, or environmental factors.
Like that example in the research about the 20-year difference in life expectancy between two neighborhoods in Philadelphia just 4 miles apart? That's insane. It's all because of socioeconomic factors.
It is, and it highlights how deeply intertwined health and social conditions are. These factors, like poverty, lack of access to healthcare, and even where you live, are called social determinants of health.
So it's not just about individual choices, it's about the systems and structures that create these inequalities.
Right, and as nurses, we need to be aware of these disparities and advocate for equitable care for everyone, regardless of their background.
That makes sense. But where do we even begin to address something as complex as health disparities?
It starts with recognizing that our patients are not just collections of symptoms. They're whole people with unique experiences and challenges.
So it's about seeing the bigger picture and understanding how those social determinants of health actually affect people's lives.
Exactly. And that brings us to another important concept, the human dimensions of health.
Okay, so I remember the research mentioned 6 key dimensions. Can you give us a quick rundown of what those are and how they all fit together?
Sure. We have the physical dimension, which is your body, its functions, and its overall health. Then there's the emotional dimension, which encompasses your feelings and mental state.
Right, because we all know that stress and anxiety can take a toll on our physical health too.
Absolutely. And then we have the intellectual dimension, which is all about how you process information, especially information related to your health.
So like a patient's understanding of their illness or their ability to follow their treatment plan?
That's a good example. And we can't forget the environmental dimension, which considers the impact of your surroundings on your health. Things like air quality, water quality, and even access to green spaces.
It's like that saying your zip code is more important than your genetic code.
Exactly. And then we have the sociocultural dimension, which acknowledges the influence of your culture, your background, and your social networks on your health beliefs and behaviors.
Like how different cultures have different approaches to diet and exercise, or how family traditions can impact health choices.
Right. And lastly, we have the spiritual dimension, which is about your values, your beliefs, and your sense of purpose in life.
And that can be a powerful source of strength and resilience when facing illness or adversity.
Absolutely. So you see, each of these dimensions interacts with the others to create a complex and unique health experience for each individual.
Wow, it's like a tapestry with all these different threads woven together.
Yeah.
And as nurses, we need to understand the whole tapestry, not just one little piece.
Precisely. It's about recognizing that every patient is unique and tailoring our care to meet their individual needs.
Speaking of individual experiences, there was that really interesting story about Molly, the student who considered her friend Carrie to be healthy, even though she had a terminal illness. Can we talk more about that?
I think it's a great example of how our perceptions of health can be so different and how those perceptions shape our experiences.
Molly seemed to define health more as a state of mind, a feeling of well-being and happiness, rather than the absence of physical illness.
And that's perfectly valid. Health isn't always black and white. It's about finding ways to live a full and meaningful life, even in the face of challenges.
Which makes me think about the role we play as nurses. It's not always about curing disease, but about helping people live their best lives, whatever that looks like for them.
That's a beautiful way to put it. And it's at the heart of what we do as nurses, caring for the whole person, mind, body, and spirit.
This has been a fantastic conversation so far. We've covered so much ground already, from the basic definitions of health and wellness to those complex social determinants and the different dimensions of the human experience.
It's a lot to take in, but it's also important for understanding the complexities of health and illness and how we as nurses can approach care in a truly holistic and patient-centered way.
So what's next on our deep dive? What other gems are hidden in this research you provided?
Well, now that we've laid the groundwork, I think it's time to get into the practical side of things. Let's talk about those different levels of prevention, primary, secondary, and tertiary, and how nurses can play a vital role in each of them.
That sounds great. I'm eager to see how those levels of prevention translate into real-world nursing scenarios. Let's dive in.
All right, so let's talk about those levels of prevention you just mentioned. It's really a framework for understanding how we can intervene at different stages to promote health and manage illness.
So it's about being proactive, not just waiting for people to get sick.
Right. Exactly. It's about a shift in focus, from just treating disease to actually preventing it in the first place.
Okay, so remind me again, what are the three main levels?
So we have primary, secondary, and tertiary prevention. Primary prevention is all about preventing disease before it even starts.
Okay, so like what kind of things are we talking about here?
Well, think of things like immunizations or teaching people about healthy eating habits or the importance of exercise.
Right, things that everyone can do to stay healthy.
Exactly. And then we have secondary prevention, which focuses on early detection and treatment of diseases.
So catching things early before they become a bigger problem.
Exactly. Things like screenings for cancer or regular checkups with your doctor.
That makes sense. So what about tertiary prevention? When does that come into play?
Tertiary prevention is about managing and minimizing the effects of an illness that's already present.
So for example, if someone has a chronic condition like diabetes.
Exactly. Tertiary prevention would involve things like helping them manage their blood sugar levels through medication, diet, and exercise.
So it's about helping people live their best lives, even with a chronic illness.
Exactly. And nurses play a crucial role in all three levels of prevention.
It sounds like it. Yeah, from educating patients to providing direct care and advocating for policies that promote health.
Right. And speaking of influencing health behavior, the research also mentions some important models of health promotion and illness prevention. These models help us understand what motivates people to make healthy choices or not.
Yeah, I remember thinking those models were really interesting. Can we dive a little deeper into those?
Absolutely. So one of the models mentioned was the health belief model. This model suggests that people's beliefs about health threats influence their willingness to take action.
So it's not just about knowing the facts, but also how people perceive those facts.
Exactly. So, for example, if someone doesn't believe they're at risk for a certain disease, they're less likely to take steps to prevent it.
Even if the evidence is clear.
Right. And the model highlights three key perceptions that influence health behavior: perceived susceptibility, perceived severity, and perceived benefits.
Okay, I'm following you so far, but can you break those down a little more?
Sure. Perceived susceptibility is a person's belief about how likely they are to get a particular illness.
So someone might think, I'm young and healthy, I'll never get heart disease, even though their lifestyle choices might put them at risk.
Exactly. And then there's perceived severity, which is how serious they think the consequences of the illness would be.
So they might acknowledge that they could get heart disease, but think, oh, it's treatable, no big deal.
Right, which could lead them to underestimate the real risks.
Yeah.
And lastly, we have perceived benefits, which is how much they believe taking action will actually reduce their risk.
So someone might think, yeah, eating healthy is important, but it's too hard, and I don't think it'll really make a difference.
Exactly. So all of these perceptions, whether they're accurate or not, play a big role in shaping people's health behaviors.
This is making me think about that woman in the research, Ruth, who had the mini stroke. She didn't seem to fully grasp the seriousness of her condition or the importance of making lifestyle changes to prevent another one.
That's a great example. And using the health belief model, we can understand why Ruth might be resistant to those changes and develop strategies to help her see the benefits of taking action.
That's so helpful. It's like having a roadmap for understanding people's motivations and tailoring our interventions accordingly.
Exactly. And then there's the health promotion model, which takes a more holistic approach. It looks at how people interact with their environment as they strive for health.
So it acknowledges that health is not just about individual choices, but also about the context in which those choices are made.
Precisely. It considers things like a person's background, their resources, their social support, and even their beliefs about their own ability to change.
That makes so much sense. Because sometimes people want to make healthy choices, but there are all these barriers in their way.
Exactly. Like imagine someone who wants to exercise more, but they live in a neighborhood that's not safe for walking or running.
Right.
Or someone who wants to eat healthier, but they can't afford fresh produce.
Those are real challenges that we need to be aware of as nurses.
Absolutely. And the health promotion model helps us to see those challenges and develop interventions that are more effective.
I really like how these models highlight the importance of understanding the individual and meeting them where they're at.
That's key. And speaking of meeting people where they're at, the trans-theoretical model of change is another really helpful tool. It describes the stages people go through when making a behavior change.
Oh, yeah. I remember that one. It seemed super relevant to nursing practice.
Absolutely. So the first stage is pre-contemplation, where someone's not even thinking about change yet.
So they might be in denial about a problem or just not aware of the risks.
Right. Then comes contemplation, where they start to think about making a change, but they're not quite ready to commit.
So they're weighing the pros and cons.
Exactly. And then comes preparation, where they start making plans and setting goals.
So they're getting ready to take action.
Right. And then, of course, comes action, where they're actually putting those plans into motion.
This is where the rubber meets the road.
And then we have maintenance, where they've successfully made the change and are working to keep it going.
It sounds like it takes a lot of effort to get to that point.
It does. And lastly, there's termination, where the old behavior is completely gone and they're no longer tempted to go back to it.
So it's like a journey with all these different stages, and each stage requires a different approach.
Exactly. And as nurses, we can use this model to guide our interventions and provide the right support at the right time.
It's like we're walking alongside our patients on their journey to health.
That's a great way to put it.
Oh.
And it's a privilege to be a part of that journey.
Wow. This has been such an insightful discussion about those different models of health promotion. I feel like I have a much better understanding of how to apply them in practice now.
I'm glad to hear that. And I think it sets us up nicely for the next part of our conversation, which is about vulnerable populations.
Yeah, that's a really important topic. Because as we've seen, health is not just about individual choices. It's also about the social and environmental factors that create health disparities.
Exactly. And understanding those disparities is crucial for providing equitable and effective care for everyone.
Well, let's dive into that then. It's amazing to think about everything we've already discussed. It really shows how complex health and wellness is. It's not just about individual choices, right? It's also about those bigger systemic issues, especially when we talk about vulnerable populations.
Absolutely. All those social determinants of health that we talked about earlier play a huge role in creating those disparities that we see.
Yeah, like the research talked about people experiencing homelessness and how they face incredible challenges when it comes to health.
Right. Just imagine trying to manage a chronic condition like diabetes when you don't even have a safe place to sleep or regular access to food.
It's heartbreaking.
Well,
And it just highlights how those social factors can completely overshadow any individual effort to be healthy.
exactly. And then there are the disparities linked to race and ethnicity, which we touched on earlier. Those are deeply rooted in systemic inequities.
It's really concerning to see those statistics about higher rates of chronic illness and even death among minority populations.
Yeah, it's a complex issue with a long history, but a lot of it comes down to things like discrimination, lack of access to quality health care, and implicit bias.
The COVID-19 pandemic really exposed those vulnerabilities, didn't it?
Oh, absolutely. We saw how communities of color were disproportionately impacted with higher infection rates and death rates. They often had limited access to testing and treatment, and were more likely to work in essential jobs that put them at higher risk of exposure.
It's a stark reminder that we still have a long way to go in terms of achieving health equity for everyone.
Definitely. So as future nurses, what can we do to help address these disparities and advocate for these vulnerable populations?
That's a big question. Where do we even begin?
Well, I think it starts with developing cultural humility, recognizing that we don't have all the answers and approaching each patient with genuine respect and an open mind.
So being willing to learn from our patients and their experiences.
Exactly. We also need to go beyond just treating the immediate health concern and try to understand the broader context of their lives.
So looking at those social determinants and how they might be impacting their health.
Right. For instance, a patient struggling with poverty might not be able to afford the medications, or someone who doesn't speak English might have trouble understanding their treatment plan.
It's about seeing the whole picture and connecting the dots.
Exactly. And that might mean connecting them with resources like social workers or community health centers, or advocating for policies that promote health equity.
It sounds like being a nurse for vulnerable populations requires a lot more than just medical knowledge. It's about being an advocate, a resource navigator, and a compassionate presence in their lives.
Well said. And ultimately, it's about remembering that core principle of nursing, providing holistic care that addresses the whole person, not just their disease.
This whole deep dive has been so eye-opening. We've covered so much ground, from defining health and wellness to exploring those different models of health promotion and illness prevention, and then taking that broader look at how social determinants of health and health disparities impact entire populations. It's a lot to process, but it's also vital for anyone going into nursing.
I agree. These are the foundational concepts that will shape your practice and help you provide truly patient-centered care.
So as we wrap up, what's the one key message you hope our listeners take away from this deep dive?
I think the biggest takeaway is the importance of holistic care. Recognizing that health is so much more than just the absence of disease. It's about understanding the whole person, their unique circumstances, and their individual journey towards well-being.
And to all our listeners out there, keep asking questions, keep challenging the status quo, and never stop learning. Your journey and understanding health and wellness is just beginning. This deep dive might be over, but we hope it sparked a passion for providing compassionate and equitable care for everyone. Thanks for joining us.